All right, commissioners, whenever you are ready. No, both of you have, yours are always on. Some of them are just always on.
Okay. Okay.
Yes, whenever you're ready.
Okay. Thank you. Good afternoon, and welcome to the Joint Conference Committee meeting of the Laguna Honda Hospital and Rehab Center for April 11th. I'd like Secretary Moritz to call the roll, please.
Yes, sure. Commissioner Guillermo
Present.
and Commissioner Green.
Present.
Thank you. I will read the land acknowledgments. The San Francisco Health Commission acknowledges that we are on the unceded ancestral homeland of the Ramaytush Ohlone, who are the original inhabitants of the San Francisco Peninsula. As the indigenous stewards of this land and in accordance with their traditions, the Ramaytush Ohlone have never ceded, lost, nor forgotten their responsibilities as the caretakers of this place, as well as for all peoples who reside in their traditional territory. As guests, we recognize that we benefit from living and working on their traditional homeland. We wish to pay our respects by acknowledging the ancestors, elders, and relatives of the Ramaytush Ohlone community and by affirming their sovereign rights as First Peoples. The second item on the agenda is the approval of the minutes for the meeting of March 14th, 2023.
Okay. We have minutes in hand, and if I can have a motion to approve.
So moved.
All right, and before we go there, I have a statement to read about public comment, then I'll need to ask about public comment. For each agenda item, members of the public will have an opportunity to make comment for up to 3 minutes. The public comment process is designed to invite input and feedback from individuals in the community. However, the process does not allow questions to be answered in the meeting or for members of the public to engage in back and forth conversation with the commissioners. The commissioners do consider comments from members of the public when discussing an item and making requests to the DPH. Please note that each individual is allowed one opportunity to speak per agenda item. Individuals may not return more than once to read statements from other individuals unable to attend the meeting. Written public comment may be sent to the Health Commission at the following email address: the word health.commission.dph@sfdph.org. If you wish to spell your name for the minutes, you may do so during your verbal comments without taking your allotted time. Please note that city policies, along with federal, state, and local law, prohibit discriminatory or harassing conduct against city employees and others during public meetings and will not be tolerated. We will first take public comment from individuals attending the meeting in the room in person. We will then take remote public comment from individuals who have received an accommodation for a disability. I've given 3 people accommodation for a disability, so there's only 3 in that category. I've given each of these individuals a code to speak when they begin their comments to prevent others from speaking during this time. Finally, we will hear remote public comment from all other individuals. There will be a time limit of 20 minutes on the total amount of remote public comment that can be heard on each item from individuals who have not received an accommodation for disability. Because of the new remote public comment procedures recommended by the Office of the City Administrator and City Attorney's Office, please do not raise your hand to make remote public comment on an item until your category is called. Okie doke. So that was a lot. If you'd like to make comment on item 2, the minutes, please press star 3. We don't have anybody in the room who's willing to do that at the moment, so we've got 2 hands. I'll put 3 minutes on the clock and unmute the first caller. Caller, please let us know that you're there.
I am Mark Patrick, code WW.
Please begin, Mr. Manetchal.
Thank you. These minutes are problematic. Compared to the poll commission's March 21st minutes that contained a 4-page summary of Director Colfax's report, these minutes contain not one word summarizing Mr. Pickens' executive team report, item 4. From these minutes, the public isn't informed that Pickens reported that the second 90-day monitoring survey had ended on March 17th, nor do these minutes mention Pickens reported orally that 23 preliminary deficiencies were cited during that survey. Currently, creatively, Mr. Pickens evaded reporting the highest deficiency level received. The State Operations Manual requires CDPH to provide you with that form 2567 within 10 days, no later than 10 days following the last date of the survey. Where's that form 2567? I've requested twice. It must be released upon request. The minutes report a nursing home administrator search firm was hired on March 14th. That job was identified 9 months ago on June 22nd. Why did it take 9 months before Laguna Honda got around to hiring an executive search firm to help locate and hire a nursing home administrator? CMS and CDPH had wanted that position hired and onboarded rapidly. Why hasn't that hiring been completed yet? It should take several more months. It should not take several more months, as Commissioner Guillermo is wrongly anticipating. Thank you.
Great, thank you for your comment. And again, we are on the category of folks who've received an accommodation for disability. So if your hand is raised, I'm hoping you've got a code. All right, I've unmuted you, caller. Please let us know that you're there.
I'm sorry, I'm for general comment.
All right, Mr. Lyon, I'll come back to you the next item. And I'm just unmuting this caller again. Is this Mr. Minette Shaw? Caller? All right. All right, that's the only public comment on this item. Commissioners, and since you've made a motion and actually, I'm sorry, we're back into old-fashioned voting, so the two of you need to vote as though you're in the room together.
Okay, all those in favor?
Aye.
Aye? Aye?
Great.
Any opposed? Okay, great.
We can move on now to general public comment. And again, we're going to start with somebody in the room, and then we will go to folks who've received accommodation by contacting me, and then we will go to everyone else. So let's see. Oh, I'm sorry, we don't have somebody in the room. Let's move on to folks who are remote. If you've received accommodation for disability and you'd like to make public comment on item 3, general public comment, please raise your hand. Okay, caller, I've unmuted you. Are you there? Caller?
Yeah, I'm code AA, Michael Lyon, San Francisco Gray Panthers. About the proposed 120-bed cut. Years ago, DPH published a white paper projecting huge shortage of places where seniors and people with disabilities could get care, particularly those with low income. It's meant that already all too many people needing nursing home care are being sent out of county, usually the privately owned nursing homes with gross understaffing to earn their owners fat profits. These people are away from their family and friends whom they need to watch over their care and to fight for them with the nursing home administration. It's outrageous that this is happening in a city where individuals and corporations have such excessive wealth, but it will be much worse if the 128 Laguna Honda beds are closed. Medically speaking, there's no justification for closing the beds. Laguna Honda rooms are large enough to safely accommodate 3 beds. You know this is true because of the unusually low rate of COVID transmission at the height of the pandemic. Laguna Honda and its residents are paying for years of mismanagement and misuse by the health department, and now you're caught in an uncomfortable position. But for those of us who may need Laguna Honda, it's a desperate position. It's your duty to clean up your mistakes, but it's also your duty to protect the hospital and the city. Use the exception option. We saw the results of kicking people out of Laguna Honda. Think about the results of not letting them in the first place. Thank you.
Thank you for your comment. All right, caller, I've unmuted you.
Hi, it's Dr. Palmer, LL. I just wanted to make a general comment that the rules now for testifying are so difficult that it's really discouraging people who really would like to testify by phone from testifying. And I think you should rethink this. It's so complex and multi-step that, it's just impossible. And furthermore, today, I hope my friend Ann Coltitas, who's trying to get there, made it because the elevator was broken. So you can't even get there if you're willing to come. I mean, it's a little bit crazy, and it's kind of like the health department doesn't want to hear from anyone. It's really discouraging. Thank you.
Thank you for your comment. All right, caller, you're unmuted.
Hello?
Yes.
Yes. Hello, commissioners. My name is Norm Daleman, and I'm a longtime resident of San Francisco and a member of the Great Panthers. And I'm concerned about the transfer of patients from Laguna Honda. Thank you very much for your time, and thanks for listening.
All right, that is all the public comment on this item. Thank you, callers. We can move on to item 4, which is the executive team report.
Good afternoon, commissioners. How are you?
Afternoon.
Roland Pickens, interim chief executive officer at Laguna Honda Hospital, here to present the executive team report on behalf of the Laguna Honda executive staff. As you know, we're in a new setting today for our JCC. I am here in person, but other members of the executive staff are on the line and are there in case I need assistance, but I will try to answer as many questions and responses as I can on my own. And for my colleagues, just stand by. Don't feel obligated to jump in. I will call upon you if I need your assistance. Okay. So happy to present this report dated April 11th. Next slide. Okay. So we all recall what brings us to this point in the history of Laguna Honda, the April 2022 decertification from participation in the Medicare and Medicaid provider program. Next slide. Okay. Currently, we are operating under a continuation of the pause of involuntary discharges and transfers that was originally granted in November of last year and then extended on February 1st of this year. And that pause on discharges and transfers is effective at least through May 19th of this year. Next slide. Part of the settlement agreement between the city and county and CMS requires that there are 90-day CMS monitoring surveys conducted of Laguna Honda. As you know, that first survey took place late December of 2022. During that first survey, there were 124 deficiencies that were identified. The second survey recently took place last month, March 13th and 17th, and there were an anticipated preliminary 23 findings. That second survey actually consisted of a initial monitoring survey, and then it went into what's called a second extended survey due to some findings during the survey which required CMS and CDPH to do some further investigation. We participated in an exit conference with CDPH back on March, for that March survey, and were under the impression that both surveys had been closed, and part of that process of exit surveys is CDPH always reserves the right to have further investigation and review, supervisory review of their findings that they shared with us verbally. So consequently, last Thursday or Friday, two CMS surveyors reappeared at Laguna to let us know that the extended part of that survey actually was continuing and was not formally closed out. To that extent, they were there last week and have not come back yesterday or today, but have also not indicated that they have closed that extended survey. So we are still in extended survey status from the second monitoring survey. And as soon as we have more information, we will definitely keep the JCC updated. Also would like to share that late last week on either Thursday or Friday, we received a partial 2567 from the state from the second monitoring survey. I say partial in that they gave us findings in two of the smaller areas, fire life safety and emergency preparedness. That partial 2567 showed there were 5 findings in fire life safety, which, as we know, is significantly less than what we saw the first go round because we had serious deficiencies there. And actually, there were 0 findings in the area of emergency preparedness. So great news there. Per the terms of the settlement agreement, rather than a traditional plan of correction that would be required to be submitted within 10 days, the CMS quality improvement expert is required to take those findings, conduct a root cause analysis with subsequent milestones and action plans. The QIE has already engaged with the Laguna team this week, and QIE expects to turn around their root cause analysis and milestones and submit those to CMS for approval by Monday, April 17th. And we will keep the JCC and Commission updated on the progress of that document. Next slide. So I referenced the settlement agreement and the root cause analysis and the action plan. And just to remind everyone that the action plan is really our new blueprint for moving towards recertification in the CMS program. Next slide. So just an update in terms of where are we with the action plan. We previously reported that in January, we successfully submitted all 126 milestones, 100% completion. Same thing in February, successfully completed 133 milestones, 100%. And as of yesterday, the QIE validated that we successfully completed all 77 milestones that were due for March. So at this point, we have completed 74% of the 456 action plan milestones, and we have 120 milestones that are due for the month of April. And we are fervently working to make sure that we maintain our perfect track record of success. And what I've shared with staff is that while we focus on number of milestones completed and being 100%, we do that because it serves a purpose. And the purpose it serves is to have a quantifiable, validated proof to CMS that we are making progress towards regulatory compliance and recertification. Next slide. And as a reminder, this is just a visual of our path towards recertification. The top refers to all the survey readiness activities, the 90-day monitoring survey cycle. And then at the bottom refers to the various action plans, the original action plan, and the subsequent revised action plans that are based upon the first and second monitoring surveys. Next slide. So part of that settlement agreement had a requirement that Laguna Honda submit and get an approved closure plan from CMS. As you know, our original closure plan, after several iterations, was accepted and then was revised based upon the settlement agreement. Laguna Honda received feedback from CMS late last year. Laguna Honda returned its revisions to CMS on February 2nd. and up until last week had been awaiting correspondence back from CDPH and CMS on the status of our revisions, and we can now report that CMS, CDPH reached out to us and have scheduled a meeting with us for this coming Thursday, April 13th, to review their feedback on our revisions that were delivered on February 2nd. So we will keep the JCC and Commission updated on the status of that closure plan. Next slide. You recall that we shared here before that we were successful in getting 6 of the Laguna Honda leadership team enrolled in the very prestigious and highly coveted California Association of Health Facilities Leadership Academy. This is the premier association for all skilled nursing facilities in California. And you see a picture here of Laguna Honda leaders who are participating in this year-long fellowship. They include individuals from food and nutrition services leadership, facilities leadership, and nursing operations leadership, in addition to Laguna Honda executive staff. These individuals will work on a capstone project related to work at Laguna Honda, and we will make sure that we share their learnings at the conclusion of their fellowship year, so that both the JCC, the Health Commission, and the greater Laguna Honda community can learn how this fellowship was beneficial to the organization. Next slide. I also wanted to give you an update on our improved grievance process. Grievances was one of the grievance process was one of the areas of improvement identified both in previous surveys and in the root cause analysis. And to that extent, Laguna Honda has revamped its grievance process, have hired its very first ever resident patient safety advocate, whose primary job is to follow up with all grievances that are made. And for an institution the size of Laguna, that, as you can imagine, can be quite a challenge. Part of the feedback from previous surveys was that given its size, Laguna had actually had few grievances that one would expect for a skilled nursing facility of its size. Well, we've remedied that now with the revamp of the program. We've installed grievance boxes on every nursing unit and other locations across the hospital. Jan Doyle, that new patient safety, resident safety advocate, checks the boxes every day, and his job is to follow up on grievances, to address the issues, and then to close the communication feedback loop with residents and or their family or decision makers. So we're really excited about this. One would say, well, why are you excited about grievances? But we learn through our grievances. This is the direct voice of the resident and or their families. And so it's an opportunity for us to be responsive in a resident-centered way. And then next slide. And finally, this is our usual slide that shows the status of admissions, discharges, and expirations at Laguna. And that concludes my formal presentation, and I'm happy to answer any questions or hear comments that you may have for me at the appropriate time.
Thank you, Mr. Pickens. Mr. Morwitz, do we have comments?
Yes, we do. So we'll start with the person in the room, and I'll adjust the microphone.
Okay. All right. Thank you. Hello, commissioners. My name is Ann Colachitas with San Francisco Gray Panthers. Thank you for the executive team report. You know, what didn't mention was, what about the people, really? What about the people that are in Laguna Honda? We have regulations and we have all kinds of, procedures, but it doesn't address the reason Laguna Honda is there in the first place. Laguna Honda belongs to the people of San Francisco, and the Department of Public Health and all the consultants. They just work there. So it belongs to us. We didn't hear what is the status of where people are going to go. I mean, the research is in for Laguna Honda. You know, transfers kill. And so, you know, we didn't hear really anything about that on this report. Thanks.
All right.
Thank you for your comment.
Folks on the line, if you have received an accommodation for disability and you've gotten a 2-letter code, please feel free to raise your hand. I'll be asking for that to make sure that those folks are prioritized. Okay. Caller, you're unmuted. Please let us know that you're there.
I am Mr. Moore. It's tragic, and you didn't call on me during public comment when I had my hand up again.
Mr. Minetshaw, would you like to make comment now?
Can I make public comment and then come back to this item number 4?
No, right now let's do this and finish this item first, and then we can come back to you. Let's do
All
that,
right,
please.
I want you to come back to me. So
Yes.
regarding the executive team report, it's good hearing from Mr. Dickens that you received a partial form 2567 last week, and it's unfortunate that you're going into an extended survey, which tells me that they found serious problems again, and you have not indicated what the highest severity of citations were in the partial survey. But I want to remind Ms. Harris, who is on this call via WebEx, because I can see her name, that she needs to send me that 2567 today and comply with my public records request. She and the public records staff are not allowed by the Sunshine Ordinance to convert an immediate disclosure request to a standard request. If I don't get that partial 2567 today, I will file a complaint with CDPH that you are violating the state operations manual that says you must make that available to the public upon request. I've requested it twice. You've been delaying me for 2 weeks about getting this, and I'm still concerned. Mr. Pickens and Dr. Kovacs are claiming that you had 124 deficiencies on the first 90-day monitoring survey that was in the January 31st root cause analysis report that reported only 76. The difference between 124 and 76 is a magic whopping 48, which means we are not being told the truth about just how many deficiencies were uncovered in that first monitoring survey that ended in December. So you guys need to come clean and come honest about your methodology and your numbers about just how many deficiencies have been uncovered in December. Thank you.
Okay. Let's see. There's 3 hands up. I will unmute the next person. Caller, you're on.
It's Dr. Palmer again, LL. It's interesting that CMS is meeting April 13th for feedback on the revised closure plan. I think it's time to impress upon them, if in case somehow they're not already aware, that there is no safe way to close and discharge Laguna Honda. And I have not heard anything that will reassure me that Laguna Honda residents who are evicted will be safe and will not die. I would like to see a publicly available draft of the revised closure plan. And there are certainly not enough high-quality nursing homes in the county or even the general region to accept medically complex Laguna Honda patients. Also, in Mr. Pickens' presentation, there is no evidence that the city attorney has requested a waiver or exception to the 120-bed cut. Please, eviction, closure, and bed cuts must not occur. Thank you.
Okay, thank you. And last caller. Caller, you're unmuted. Let us know that you're there.
Yeah, I want to emphasize the what Dr. Palmer has said. Any attempt to begin transferring patients, again, closing and transferring patients, will just be a repeat of what we saw last time, and it would be a disaster. I don't know how you can even think about this and talk about a closure plan is just an abomination. And why haven't we seen it? Thank you.
All right, Commissioner Guillermo, I did not see Mr. Manette Shaw's hand, but is it okay if we go back to?
Yes, that's fine.
Okay. Mr. Manette Shaw, I'm going to unmute you for your general public comment.
Okay, thank you, Mr. Morowitz. I squeezed in my extended comments for public comment on item 4. So I'm grateful that you recognize your mistake that you didn't call on me during public comment, but I'll cut this short and let you go back to your meeting.
All right, thank you. Okay, Commissioners, that is all the public comment that I see.
Okay, thank you. Are there any questions from the committee?
Yeah, thank you so much for the presentation. And I think it's pretty clear we all share the same concerns that it would be disastrous to try to transfer patients, and the uncertainty of this deadline in May coming up and having so little information to go on is very difficult for residents, staff, and the community at large. And I think likewise, we are concerned about the capability to handle SNF beds in San Francisco, and there's no question that 120 beds is a huge concern. So I'm curious a little bit about timeline, because as I look at this meeting on the 13th, and I look at the rhythm that we've seen from CMS and CDPH, I'm wondering if you could give us a sense of what you think the outcomes might be, including whether it's possible on the 13th they could say, we're going to extend the May 19th deadline, or whether that would even be possible. And then the other question I have is what the steps are with regard to the waiver for 120 beds. I think there may be some need to kind of close off oxygen or things in the rooms, and whether, that can be reestablished if needed, and whether we have to be recertified in order to even apply for a waiver. I mean, do we have any sense of the steps that would, that would be needed in order for those 120 beds to be reactivated? Because we've all certainly asked, the public has asked, and we may not know, and we're certainly at the mercy of these other organizations in many ways. So if you have any clarity on either of those issues, it would be so helpful.
Sure. Thank you for the question. So the first question regarding the meeting on the 13th with CMS and the state about the closure plan. That meeting is the stated agenda, definitely is the closure plan. Obviously, this has dragged on for months now, so we are eager to bring it to resolution. I have to say that it's always been our desire that this closure plan, although a requirement under the terms of decertification and then the settlement agreement, is something we hope will never be used, and that will be a moot issue. However, it is a requirement in order for the continued funding that we have a closure plan, and an approved one. So to the extent that this meeting is happening, we're glad about that. In terms, we will definitely take the opportunity while we have all the players at the table, while it's not stated on the agenda, we will definitely reiterate our desire that we pursue a continuation in the pause. And every opportunity we get with leadership at CDPH and CMS, we do relay that information, and we'll certainly do it again on the 13th. Whether or not they will engage in that separate discussion on the pause remains to be seen. I'm hopeful if they will, we will definitely keep the JCC and Health Commission updated on their response. In terms of the 120 beds, you recall that I shared that we, while still making sure we meet the current CMS guidelines that state no more than 2 residents per room, we have made sure we have preserved our options to still be able to have that third room, those 120 beds occupied. So while we have temporarily placed caps, say on the wall, the med gases in the walls, those caps can simply be removed and the gas reinstalled pretty quickly. So we, by no means have we closed the door on operationalizing those 120 beds. In fact, you recall we reported that we made sure when we renewed our license for Laguna Honda this year, we made sure we renewed that license with the full complement, including those 120 beds. So all the while, we've made sure that we've preserved the option to be able to have a resolution to this 120-bed issue. In terms of where we are in that process, in our discussions with CMS, we continually remind them of the dearth of skilled nursing beds in San Francisco. That's been evident since DPH conducted that study 7 or 8 years ago that showed at that time San Francisco had a dearth of 700 beds, and I can only imagine how that's increased since then. So CMS and CDPH are all aware of the importance of those beds, and we are doing everything we can to pursue the process. We are in discussions with the city attorney who advises us on legal, particularly regulatory issues and the legal consequences and implications of that. And so they are advising us specifically on this issue of is a waiver an appropriate mechanism that we can pursue at this time. And we will keep you updated as soon as we get definitive information on that.
Do we know if any other even nursing home chains or jurisdictions have brought this up? Because obviously there are other places where they've had to reduce the number of beds. Is there any precedent that we can look to one way or the other? Has CMS made, brought in any waivers or made any decisions in this regard in any other jurisdictions to this point?
I'm not personally aware. I have heard that there are instances where other institutions have been able to receive a waiver. My understanding is that those that have were in good standing with CMS and were not in a state of decertification. But again, I've only heard that anecdotally. I've not seen documentation to support that.
So there's really nothing that clearly indicates the steps that would be needed. In other words, do we need to be recertified before they'd consider a waiver? We're just at their mercy, basically. It sounds like, with no precedent, no sense of what would come next.
I would say that I think we can have a better answer and assurance on that question once we receive our response from the city attorney in terms of their legal investigation on the waiver option to see if it's an advisable step that we should be taking.
And how is the staff doing? And do you feel that with the newest extended survey, how's morale? And do you feel how will that affect what is supposed to be accomplished by the middle of May?
Well, obviously, being notified almost 3 weeks after the exit survey that we're actually still in active survey status was an unusual step. That by all indications from individuals that it's an unprecedented step that no one's ever heard of. At the same time, our understanding is that it's a very focused, the surveyors in true survey fashion are not really communicating with us the particulars other than making document requests. So they're not saying, we're here for XX and this is what we're finding. It's just radio silence, but that's typical surveyor activity. We probably won't know until they do another exit, and really we won't know until they give us a 2567 in writing, and because that's the formal ending of the survey.
Well, thank you, and I hope everyone there is hanging in there. It's a difficult time.
It is. You know, we're on now, it's been almost a year since decertification, and so we've asked a lot of our staff. And so I think people are tired and they're weary, but at the same time resolute, knowing how important Laguna Honda is. And I constantly remind staff the last month or so that it's been a long journey, but the journey is not over, and we've got to work together to make sure we get over the finish line.
Thank you.
Thank you, Mr. Pickens, and I join with my fellow committee member, commission member, in expressing our gratitude and concern for the staff and all that has been done, and hope for resolution as soon as, as soon as grace allows us. Regarding this meeting on Thursday with CDPH, do we know which players are coming to the meeting? Are we familiar with them? And are they individuals who we have a sense will have some authority and decision-making ability, or is this just do you get a sense that this is another step in the process that we are yet to see the full light at the end of the tunnel?
So yes, we do know who the attendees are, and they are the highest level attendees from CDPH and CMS that we've been working with. The CMS regional director and assistant director, and then the CDPH lead that was appointed by Secretary Galley. She and her staff will be there. So these are the highest level individuals that we've been working with all along.
Great. Well, that's, I mean, I guess that's some good news that we're at least getting the key folks meeting with you. And then with regard to the extended survey, the fact that they have not come back today or last Friday, do you read anything into that? I mean, you did mention a little bit, but given, have they not asked for additional documentation, or is it some of the reason that they were not able to come Friday and Monday?
Sure. If I had to speculate, it would be that they are reviewing the documents that we provided them when they first arrived late last week. And they actually did do some staff interviews also, so they're probably reviewing all of that before coming back and either requesting more documents or having additional communication with us. So the fact that they've not requested, that they've not been back, I'm optimistic that that means, again, that it's a very narrowly focused continuation of their investigation and should hopefully conclude soon.
Okay, great. And then just my last comment is with regard to the California Association of Health Facilities membership and the meeting or the Leadership Academy that Laguna Honda managers and leaders attended. I would hope that at some point in the coming months, when we have, I think, the space to really appreciate what the learning is at the Academy, that we might hear from some of the folks about their impressions and what the impact of this membership is with regard to the ongoing operations and future of Laguna Honda is from their perspective.
Absolutely. I will tell you, when they came back almost 2 weeks ago from the first session of the Academy, they were elated, just saying how eye-opening it was and just how beneficial they think it'll be to Laguna and our journey towards recertification. Great.
Thank you, Mr. Pickens. Oh, yes.
At the pleasure of the chair, can I just
yes, please,
Mr. Pickens, Grand Colfax Director of Health, just with regard to the closure plan and the potential requirements to transfer patients, residents. Can you just share with the commissioners again that there are different populations of residents at Laguna Honda, that require different levels of care, and
Yes.
that with the approval of a closure plan, what your thinking is in terms of the patients who have a need for a lower level of care, in other words, not SNF care.
Absolutely.
Thanks.
Yeah. Thank you, Dr. Colfax. So you'll recall under the terms of the closure plan that Laguna Honda is on pause for doing any facility-initiated discharges or transfers. Transfers meaning transfers to other skilled nursing facility. Discharges meaning discharges not to a skilled nursing facility, but either to home or some other community placement, be it a boarding care or a locked behavioral unit, those types of things. All the while, we've been able to still proceed with resident-initiated discharges because the closure plan did not remove residents' individual rights if they choose independently to go somewhere else. So we've had a handful of those. What Dr. Colfax is referring to is the fact that throughout this process, and currently there are about 50 Laguna Honda residents who no longer meet the CMS requirements for skilled nursing level of care. Essentially, they no longer need to be in a skilled nursing facility for assistance with activities of daily living, those types of things. CMS has indicated that they want us to proceed with those 50 individuals who no longer meet skilled nursing facility care to restart the process of trying to identify places where these individuals may be referred. As we have shared both with CMS and CDPH, these are some of the hardest individuals to actually find placement for. In fact, despite the dearth of skilled nursing beds, it's easier to get someone referred to another SNF than it is to these very limited community-based resources, be it residential care facilities, residential care for the elderly, locked subacute. And so we will hopefully upon the approval of the closure plan, begin to start the work at trying to identify places for these 50 residents. And CMS has made no mistake that they definitely want people who don't require skilled nursing services to not be in skilled nursing beds at Laguna. And so they've obligated us to move forward with that. Again, we can start the process. We will document all of our due diligence, all of our efforts, who we're contacting, how often we're contacting, and we'll make every effort to move as quickly as possible. But the reality is these are because many of these individuals have behavioral and or substance use issues, and it's very hard to find places that they can safely be discharged to.
Thank you for that clarification and that categorization, because it sounds like something that may be imminent as we are asking for the closure. I mean, the resolution of the closure plan will have to start moving on that work, and don't want it to be a surprise.
Yes.
Or be unprepared for those actions to be taken.
Correct.
Thank you.
Thank you. Shall we move on? Item 5 is a presentation, fiscal year 22-23 facility assessment.
Hello, I'm Elizabeth Schindler, just doing a sound check that people can hear me.
Yes, you sound loud and clear.
Okay, sounds good. So I will be talking about the updates to the facility assessment from this current fiscal year. And there's a PowerPoint. So my name is Elizabeth Schindler. I'm the Director of Performance Improvement. I sit in Quality Management. Next slide. So the facility assessment is required to conduct an annual assessment report to determine the necessary resources required to care for residents completely during normal day-to-day operations and emergencies. So it's an annual report. We brought this forth to you sometime last fall as we looked back at last year's data. This is coming forth to the commission as we have some updates to present. And the next set of slides will talk about what those updates are. Just continuing over here, so the assessment includes resident population served and care needs based on physical and cognitive disabilities, staffing and competencies on services provided, and risk analysis for systems and resources in the North and South Tower hospital buildings, and we're spanning over 500,000 square feet. Next slide. These are the 6 areas that we've updated. And so we did a full review last fall, and as I said, we've since updated. The reasons why we've updated for this set is phase 3 regulations came into place in October last year. So that wasn't ready at the time when we updated it. So we've updated with phase 3. Since then, we've also had the root cause analysis, action planning, and December monitoring survey. Through all those, there were findings that led directly to root cause analysis and action plans for specific reasons to update this. And currently, we're also taking into account updating the data. The current data is not reflected in this report. It will be in the next few months as we're looking at data from this fiscal year. So the 6 areas are substance use disorder, allegations of abuse, education and training, infection control, CMS phase 3 requirements, that's also spread throughout all 6, and then the QAPI program. So over the next slides, I will describe all the updates that go into these categories. Next slide. Substance use disorder. There are data up here showing from a look back period from 2021 and then 2022 data, and the change of the patients from substance use disorder went from 100 to 94. This is all, at this point, it seems like older data, and that's part of the reason why we are currently updating it with refreshed data. The substance use data component was not included in previous facility assessments, so we are now including it. And then the language below describes the summary language of what was updated. So substance use treatment provided by psychiatry services, it's non-specialty level outreach, and this is embedded in clinical encounters, and specialty substance treatment services, which is group and individual and group counseling. Nursing and resident care team provide support and work in collaboration with the behavioral health services team. The phase 3 requirements that we included was that there was a team developed a substance use disorder training and a team to provide staff with knowledge of signs of symptoms of this disorder. Substance use related policies have been updated to also, the policies themselves have been updated to include phase 3. And for all this, we've been updating the policies to include phase 3 regulations. Next slide. Allegations of abuse. So it's monitored through the QAPI program. The facility QAPI program will monitor the number of incidents reported, the type of incidents reported, and the timeliness of reporting. Department managers and supervisors are expected to monitor staff performance through performance evaluations and competency checks when applicable. Phase 3 requirements also included we updated the abuse and neglect prevention policies to reflect new requirements and re-educate staff on reporting requirements and timelines to align with the requirements. There's a set of items that need to be reported within 2 hours and a set that needs to be reported in 24 hours. So this is new, and then the policy has been updated, and we've worked with staff to inform them of these changes. Next slide. The education and training. Laguna Honda Department of Education and Training provides orientation, training, and support to all new and existing employees and contractors through in-person classes, in-services, trainings, online modules via SF Learning. So this is the language that we've updated from the facility assessment. The training topics include new trainings, required mandatory based on Code of Regulations, Title 22, CDPH in-service and training program requirements, plan of corrections, policies and procedures, FRIES, that's a facility reported incidences, COVID pandemic, and identify trainings based off of staff needs assessment. The phase 3 requirements that we updated for education and training was specific requirements have been updated and includes training for contractors. Next slide. Infection control. So it's under the direction of quality management. I will also add there's a strong component now that nursing is also overseeing infection control. Laguna Honda has established a facility-wide infection control program and implemented through infection control functions of the overall quality management program. The policies complies with regulations and recommendations from CMS, CDC, AHA, APIC, and mandates OSHA, CDPH, EPA, SFDPH. So a lot of regulatory bodies to follow. Laguna Honda Infection Control continues the COVID-19 pandemic operations in response to pandemic's transitions into the 3rd and 4th year. So the phase 3 requirements specific that we focused on, it's in compliance with the new CMS phase 3 requirements for infection control, which is centered around water management plan and resident level review for antibiotic appropriateness. And this is especially around urinary tract infections. Infection control policies have been updated with phase 3 regulations. Next slide. This slide focuses just on the phase 3 requirements, and then this is embedded throughout the facility assessment. So CMS released the updated phase 3 assessment requirements, and we went into compliance starting in October 24, 2022, last fall. And after careful review, the following areas have been impacted, and these 7 areas: visitation, freedom from abuse, neglect and exploitation, restraints, transfer and discharges, assessments, trauma-informed care, staffing of behavioral services. So these policies have all been updated, and many of these policies you've reviewed through the JCC process. So that's always already come forward. And they've been updated for that. Next slide. So this is the QAPI program. There's a misprint on the top, so it should not be infection control. It should just state QAPI program under the direction of, in partnership with quality management. The goal of QAPI is to provide a systematic, comprehensive, and data-driven approach to maintain and improve safety and quality of care. Performance Improvement and Patient Safety Committee, we call it PIPS, is a vital element of QAPI program where the goal is to examine and improve care or services in areas that the PIPS committee identifies needs attention. QAPI program will roll out unit-based meetings focused on high risk, high volume, and high prone areas for the facility. I've been working on a lot of these. These are 4 areas that we've been rolling out over the last few months, and it's taken quite a lot of collaboration on the leadership level and support from nurse managers, dietitians, physicians, and then a lot of the champions as they're working and attending these meetings. So the focus is on wound and nutrition, infection control and antibiotic stewardship, psychotropic medications and behavior monitoring, and falls and restraints. And then in terms of the QAPI program, we've also updated it with phase 3 regulations. So the last slide is, that's the end of the presentation.
Okay, thank you, Ms. Schneider, for your presentation. Do we have any comments?
We do. We've got one person in the room, and then we've got several hands that are raised. And folks, again, we are on item 5, just so that we're all clear. And so we'll take the public comment from the person in the room, and then we will go to folks who have received an accommodation for disability, and then we can move on to anyone else.
Ann Colachides, San Francisco Gray Panthers. Well, regarding in the facility, it's good that we still possibility to keep those 120 beds open, but we really can't. Where is the waiver request? That's my question. We can't afford any more loss of beds, SNF beds in San Francisco. Just last week, Heritage on the Marina closed their SNF with a loss of 24 beds. So this is very, you know, those 3-bed were state of the art when they were built. San Franciscans are very proud of their Laguna Hondas. So, so let's keep going with this work. Thank you.
Thank you. Okay, so again, please raise your hand if you've received accommodation. We'll take the first caller. Caller, you're unmuted. Please let us know that you're there.
I am Mr. Morrow. It's WW, otherwise known as Thatcher.
Please begin.
During the past couple of months, Mr. Pickens claimed repeatedly to this body that Laguna Honda and DPH are doing everything they can to keep and preserve the 120 beds. We believed him, perhaps stupidly, with blind trust. It's shocking and extremely disheartening reading the facility assessment to HCAI, formerly OSFOD, that it has approved converting the 3-person to 2-person rooms by removing the beds, capping the medical gas lines, and permanently removing the bedroom doors. While Mr. Pickens just mentioned the gas lines have been capped off, he didn't mention, have the bedroom doors been removed by now too? Be honest, be transparent. Just how far along is Laguna Honda in losing those beds permanently? More shocking, page 44 of this report states that the emergency power during emergency for the entire hospital, should the power fail, was designed to minimum codes for cost savings in 2010. You should sue the architects as well as suing them for the kitchen floor. Worse, page 45 reports recertification scheduled for September 2022 is way behind schedule. Will recertification and new admissions resume in 2023? It's shocking that the city attorney hasn't submitted a waiver request yet. You have a dedicated city attorney to DPH business and presumably a deputy city attorney for Laguna Honda Hospital. What are they doing? Why is it taking so long for them to give you advice about whether it would be premature or okay to submit the waiver request now? This health commission should take leadership on this and get the city attorney's office to reply to Mr. Pickens about whether that waiver could be submitted now instead of twiddling your thumbs. Thank you.
Okay, one more hand is up. Caller, you're unmuted. Please let us know that you're there.
Hi, it's Dr. Palmer, code LL again. Unfortunately, I am going to be repetitive, and it also answers the questions of one of the commissioners. The regulatory bodies may permit and grant a variation on its number of patients per room rule when facilities request in writing an exemption that the variation to 42 CFR 483.90 ELI will not adversely affect residents' health and safety. Given that all these rooms are spacious and recently constructed, that Laguna Honda handled the COVID epidemic quite well, along with the dire need for nursing home beds in San Francisco, where is the written request for an exemption? Please. Thank you.
All right, I see no other hands.
Thank you for your comments. We can move on. Oh, I'm sorry. Are there any questions or comments from the committee? Yeah.
Well, first of all, I thought this report was excellent, and it's just so reflective of the amount of work that's gone into every aspect of the facility's assessment and how comprehensive and thoughtful it is. It was really quite impressive. It could almost be our annual report. There are so many sections in here that are valuable and reflective of all the work that's being done. I was just wondering, and you may not be able to be that specific, but when you look at the phase 3 regulations, and I know some of them come in conflict with some policies that we might prefer given our patient population, can you just give your sense of which may be the most challenging to implement, which will just sail through or are already part of our protocols? Because the regulations were so extensive, and I wondered if you have any particular challenges or concerns about these, because that is certainly going to be the next phase of our adherence to protocol and our certification.
Sure. Great question. I'll start, and then if I need any assistance, I'll reach out. But I think I can answer that. So I'll start with the easiest ones in terms of phase 3. So I think some of the easier ones include the new requirements for visitation during COVID outbreak. As you recall, that was a big issue at the early start of COVID and the resulting isolation that occurred among residents who were not able to have visitors because, prior to vaccines being made available. So phase 3 clearly states that CMS expects that visitation will continue even when an institution has an uptick or an outbreak in COVID cases. And so that just means we have to be diligent, making sure then that we are encouraging visitation like in well-ventilated areas, offering an outdoor opportunity, not just indoor in the residence room. So I think that's one of the easier ones. Another easier one is that the use of e-cigarettes is permissible, but only in designated smoking areas. And so, again, we have a designated smoking area, Serenity Park, and so we will just allow residents to, currently they have to have cigarettes under the control of the facility, so we will now be having e-cigarettes under our control for those residents who continue. So that's an easy one. I think probably the most difficult one is the phase 3 is the one related to searches of residents, particularly as we try to combat having contraband come into the facility. So phase 3 didn't do us a favor because it made two things true at the same time. It said that no longer can you search a resident without their consent. In all cases, they must consent to a search. And you cannot deny individuals admission whenever we get to the point of doing admissions who have substance use issues that would predispose them to potentially trying to bring contraband into the facility. So it basically puts us in a hard place. We have to, rightfully so, make sure that we don't exclude individuals with behavioral health issues, particularly substance use, but at the same time, it puts the onus on us to make sure we, rather than relying upon searches that we do care planning, making sure the individuals enrolled in is offered and encouraged to accept treatment services either for mental health or substance use and those types of things. So it just, that is probably the most difficult one that's ahead of us, and we're you know, doing our best to comply with both sides of the requirement.
Thank you.
I had a couple questions. Under the infection control portion, Ms. Schindler mentioned that it's under the direction of quality management, but also nursing. So I was just wondering how that coordination is going to happen, and hope that that doesn't create cause for confusion and non-compliance.
Right. Thank you for the question. So this was one of the recommendations from the QIE. Historically, infection control actually lived in the quality department. And so the QIE quickly came in and said, well, that's not appropriate. This is predominantly a nursing facility. Infection control needs to live within nursing and to make it more embedded at the unit level. So a few months ago, infection control formally transitioned from the quality department to the nursing department under the director of nursing. Having said that, we've also, as you saw, begun to initiate unit-based quality improvement programs, one of which is infection prevention and controls. And to that extent, the infection prevention and control activities will be reported up through the QAPI program, which is managed by quality management. So from a operational implementation supervision perspective, infection prevention and control lives in nursing, but from a quality improvement perspective, they report up through the QAPI program, and that was the recommendation, that we needed to be able to see their work reflected in your quality in your QAPI.
Okay, thank you for that clarification, and then I guess we'll be interested in seeing how that then plays out as time goes and
Yes.
Reports happen and policies change or get assessed and so on, and performance measures start to come in. So it'll be interesting to see that. I had another question about restraints. I know that there is a process to try to determine what constitutes a restraint and what doesn't, and how do you not consider that one of the more difficult ones to implement or to change, or is there something that is just sort of an unknown at this point?
I think it's a matter of timing. Had you asked that question 2 months ago, I would have said yes, that's one of the harder ones. But, you know, we're on top of it. We have taken the perspective of moving Laguna Honda towards a restraint-free environment. We're not there completely, but we've made significant progress with the increased focus on restraints coming from phase 3, along with the rollout of the unit-based QAPI. Every resident at Laguna was assessed who was currently receiving some type of restraint. That was about 6 or 8 weeks ago. I believe the number then was there were over 100 individuals that were utilizing restraints. I believe that number has now been cut in half. I think they're down to only about 40 or 50. So there's been a significant amount of work done. And so in addition, we, as part of the support coming from the California Department of Public Health, they have provided a surveyor to provide us technical assistance. So she's been on site at Laguna working with the QAPI, the restraint QAPI team, and has made recommendations to help clarify from a surveyor perspective how we should be making those changes at Laguna, so that we don't run afoul when they actually come for their surveys, that the changes we are making are consistent then with how the survey team should be assessing Laguna.
Okay, thank you. And again, I want to reiterate the just the congratulations on a comprehensive report and very detailed, and the improvements that are being shown particularly relative to the new phase 3 requirements. And again, I think the complexity, I guess, that's being implemented on top of all of the other things that have to be monitored, and just want to congratulate all of the hard work that's been put into this, and we'll see how things go as we continue the implementation of all of the new, I guess, new policies, right? Thank you.
Shall we move on to the next item?
Yeah.
Great, thank you again. Item 6 is the hiring and vacancy report. Sherry, we're not hearing you if you're talking.
Good afternoon.
Oh, hi, could you speak a lot louder?
Oh, sure. Is this better?
Yes, commissioners, can you hear okay? Yes, thank you.
Okay. So for the summary vacancy report, the Laguna Honda vacancies increased in March to 12.3 from 11.7 in February. We hired 26 employees between March 1st and March 31st in various classifications, and we had 3 separations in this time period with none of those retirements. The RN vacancy rate increased to 12.9% in March from 11.5 in February. Hiring managers are making selections from a refreshed long-term care eligible list, and we have 24.5 RN vacancies to fill. HR conducts regular vacancy meetings with program and hiring managers to review hiring. So there was an RN recruitment and hiring event last Saturday over at Zuckerberg General Hospital. All the time slots were filled, so we had a good turnout. And those attending the event also got a tour. So even though it was over at CSFG, Laguna Honda was also represented there. So there was a good turnout. There is a citywide career fair this coming Saturday from 10 to 2 o'clock at the Civic Center Plaza, 333 McAllister Street. Some RN highlights. 3 2320s were appointed on April 1st. We have 1 targeted to start on April 15th and 2 on April 29th. Some non-RN highlights. We have San Francisco Health Network Executive Administrator for support services targeted to start on May 13th. We have an Administrative Director targeted to start on April 15th. 1 7334 Station Engineer was appointed on April 1st. We had 5 LVNs appointed on April 1st. 1 targeted to start on April 15th and 2 on April 29th. 1 patient care assistant hired in the month of March. 3 targeted to start on April 15th and 5 in May. A total of 16 hires were on the orientation schedule for April 3rd. There's 9 on the orientation schedule for April 17th. Regarding the 2303 patient care assistants, the refreshed eligible lists for report inspection period ends today, so it's likely it may get adopted tomorrow, and we can continue hiring for the 2303s. The 2312 LVN refresh list was adopted yesterday, and we requested certification for the remaining vacant positions, so we could continue hiring the 2312s as well. And that's it for the HR vacancy summary.
Okay, thank you for your report. Are there any public comments?
Yes, folks on the line, if you'd like to make comment on this item, please press *3. I see 2 hands. We're on the hiring and vacancy report, item 6. And of course, we'll start with the folks who've received accommodation. Let's see. 1 second. There we go. All right. I unmuted you. Please let us know that you're there.
I am. It's Patrick again, Mr. Morowitz.
Please begin.
It's disturbing seeing vacancies go back up to 12.3% overall again, with the RN vacancies increasing 1.5% to 12.9%, with 27.5 vacant RN full-time equivalents. That's not including vacancies of 4 nurse managers, 2 nursing supervisors, 11 LVNs, 1.4 senior physician FTEs, 2 physicians, a psychologist, a neuropsychologist, and most importantly, the 0943 nursing home administrator position. As I said on agenda item 2 about the meeting minutes, it's sad that the nursing home administrator search firm wasn't hired until just a month ago. That job had been identified back in the mock survey 9 months ago in June 2022. What progress is being made on going through the applications you've received for a nursing home administrator, and how soon is one going to get onboarded? The sooner you get a licensed nursing home administrator position, you might get a better handle on the overall vacancy rate at Laguna Honda Hospital, particularly if you were to get rid of the acute care employees brought over from SFGH who may be lowering the morale at Laguna Honda. Thank you.
Thank you. All right. Next caller, I've unmuted you. Please let us know that you're there.
Oh, hi, it's Dr. Palmer, LL again. I'm also very worried about the certified nursing home administrator and would like an update on where we're at. The certified nursing home administrator and assistant administrator is what sets the tone for the staff, including the physicians and nurses, and can also stand up to outside interference with admission policies, which is one of the things that has caused Laguna Honda to run into trouble to admit people who Laguna Honda cannot safely care for. And I'd really like to hear a better update about where we're at on that search. Thanks a lot.
Those are the only 2 comments.
Okay, thank you. Are there any comments or questions from the committee?
Yes, I just had 2. One is, I think at our last meeting, you told us that there were some vacancies in nursing directors and that a lot of the charge nurses were stepping up and filling the gaps. So I wondered if that's still the case. And in addition, then, how are we covering the vacancies? In other words, is it registry individuals? And if so, are there people, who are familiar with Laguna? Because when you look at all the training efforts that need to be in place in order to have people work effectively, especially when we're under scrutiny, I was wondering how that's all working for everyone.
Sure, yes. And so those vacancies in permanent nurse manager assignments continue. They are being filled by a combination of 2 things. I believe 3 of the 4 are being filled by charge nurses who stepped up to be interim nurse managers. And then 1 of them is actually being filled by a nursing supervisor who has stepped down to actually give leadership to one of those vacant units to bring her expertise there. And so all of those vacancies, to the extent possible, are being filled most by registries, the non-leadership position. And so, typically registry contracts are for a minimum of 13 weeks. So the individuals go through the same training and education that our regular nurses go through, and then are there and typically will renew their assignments even after that first 13-week process. So we have registry who've been there, for a few years because, they like to work registry and they like Laguna, so they stay.
Oh, that's great news. Thank you. And then do you have any insight on where we are in finding a nursing home administrator?
Yes. I'm happy to report that, as I previously reported, the search firm was brought on board a little over a month ago. We are on target to begin. They have vetted the initial applicants who applied through the city even before the search firm came on board. They have since sourced additional candidates. So those candidates are going through the process through initial interviews, and if things move as currently planned, the plan would be to have an offer extended at least by the second week of May. Again, depending upon the quality of the applicants as they go through the interview process. If there really is one or two that float up to the top, then that is the plan.
That's excellent news. Thank you for sharing that.
Thank you. Thanks for the report. We can move on.
Item 7 is the finance update.
Hello, can you hear me okay?
Yes, could you speak up a little bit?
Yeah, sure. Is that better?
That is better. Commissioner, is that okay with you?
Okay, great. Hello, Commissioners. Lily Conover, Laguna CFO. So I have the quarterly reports, the quarter 2 reports, the financial and gift fund in your packet. So I'll start with the quarter 2 report. So you're seeing a lower than expected balance on the revenue side, and this is similar to what we reported in the first quarter. The projection is lower than expected due to lower census and the freeze on admissions. And I know that there was a question that came in about whether or not we took the recertification process and the expected lower census into consideration when we developed the fiscal 23 budget, and the answer to that is no, we didn't. The budget was developed before the decertifications, so that's why we're seeing this adjustment, the lower than projected numbers on the revenue side. On the expenses side, we have projected a 4.5 deficit on non-personnel services, which is like consulting services, registry, and other non-personnel and non-materials and supplies. Any of those types of services fall under that bucket. I know that was also a question that you had. And the majority of this deficit is due to the recertification consulting expenses. There is also some higher than expected registry, as we were just talking about with the hiring report. We have seen an increase in registry due to vacancies at Laguna. So the deficit there is partly offset by the services of other departments line, which is our work orders that we have with other city departments. And we're starting to see that trend down a bit. So I think that in quarter 3, that'll be more around $1 million rather than 1.2. But right now that is partly offsetting that 4.5 deficit on the non-personnel side. For the gift fund report, we've got a total spend for the year of $113,000 as of the end of the second quarter. We recently onboarded a new gift fund program coordinator. He joined us toward the end of December, and he's been helping us with our wish list requests. We recently solicited the nursing units for wish list requests and other departments for their requests. And so I would expect for the quarter 3 and quarter 4 report that we'll trend a little higher on the spending for gift fund due to that annual wish list process. I'm happy to answer any questions.
Thanks for your report. Is there any public comment?
Folks on the line, we are on item 7. If you'd like to make public comment, please press *3. We'll start with those who have received accommodations for disability. I'll meet the first caller. Hi, caller. You're unmuted. Please let us know that you're there.
I am, Mark. I'm going to dive right in. It's Patrick again. It's
Okay.
good seeing the second quarter finance update through December 31st, 2022. The first quarter update through September 30th indicated Laguna Honda had a Medi-Cal shortfall of $23.93 million through September. Today's update through December 31st shows the Medi-Cal shortfall of 23.74. Is the 23.74 million shortfall a cumulative total for the entire current fiscal year to date? Or is the 23.74 just the amount of Medi-Cal revenue lost between October 1st and December 31st? If it is not cumulative year to date, does that mean Laguna Honda has lost a combined total of $47.4 million year to date from lost Medi-Cal revenue? This report should state explicitly whether it is fiscal year to date or just data being reported for the second quarter. Thank you.
That is the only hand up.
Okay, any questions or comments?
Yes, thank you for the report. I just have one question, and this may be totally naive based on what goes on in acute care. But I know in the acute care we have patients who are lower level of care or administrative days. And I'm wondering if indeed there's pressure for us to transfer 50 residents who may not qualify for SNF care, whether that could affect our revenues. In other words, would Medi-Cal or Medicaid say, you know, they don't belong here, we're going to decertify these beds or decertify these patients and potentially discontinue compensation for their care as we're struggling to find proper placement?
I can try and answer that, Lily. So far that has not been the case, that Medi-Cal continues to pay for those individuals. We continue to go through the process of submission of what's called TARs, treatment authorization requests, where we clearly indicate that these individuals do not have skilled needs, and they continue to approve their ongoing stays. But part of that approval is that we then are required to show our due diligence in trying to find appropriate level of care placements for those individuals, which we do. So right now they are paying for those, and we continue to comply with all the provisions that allow that payment to continue.
And they would not use that kind of as a pressure point to force us to try to move these individuals more aggressively. I mean, they did it with the other transfers. I'm just curious. I mean, it wasn't Medi-Cal, but I'm just wondering if you have any pulse read on that.
You know, I don't. I dare not venture as to what they might try to do in the future. But what I do know right now is we are still being reimbursed for those individuals.
Okay, thank you.
Okay, thanks. I think that's it. Next item.
Sure. Item 8 is the Regulatory Affairs Report.
Good evening, Commissioners.
Please speak up.
Director of Regulatory.
Geraldine, please speak up a lot, just because the sound doesn't come in here. I apologize. Just talk louder than you normally would.
Oh, okay. Good evening, Commissioner. My name is Geraldine Mariano, Director of Regulatory Affairs. My apologies that my camera is not working. I'm not sure if you could see me, but on my screen, I just see only black screen. So my apologies for this. Okay, today I'll be sharing the Regulatory Affairs Report for Laguna Honda. This report reflects activity for the month of March 2023. Laguna Honda reported 25 facility reported incidents to CDPH for the month of March and received 3 anonymous complaints. Laguna Honda has also 3 unannounced visits for the month of March, for follow-up of the FRIES and facility-reported investigations and anonymous complaints. We also, as our CEO stated on his report, that we completed the second monitoring survey, including the fire and life safety code and emergency preparedness survey on March 17. There were a total of 23 preliminary findings, and there were 5 life safety code and 18 health safety code. There's no deficiency for emergency preparedness. We also submitted, we received 6 statement of deficiencies and have submitted plans of corrections to CDPH for the month of March. Acceptance of POC remains pending at this time. Please let me know if there's any questions or comments that I can address at this time.
Okay, thanks for your report. Are there any public comments?
Yes, and I do believe one of the public commenters has asked me to share a slide. Let me see. Mr. Minette Shaw, would you like me to share my screen for you?
What?
Would you like me to share my screen to show your slide?
Yes, if you would, sir, I would appreciate it.
Sure. Give me 1 second. Oh, I apologize. I thought I had it ready. Okay. I will begin your 3 minutes now.
All right. Thank you so much, Mr. Morowitz. This slide is taken from my new article. I asked Mr. Morowitz to email to the commissioners. You'll notice on the slide, on the first survey listed for the sexual abuse scandal, Laguna Honda received only 10 citations. Then the near fatal patient overdoses that triggered 8 successive survey inspections between October 21 and April of 2022, Laguna Honda racked up 22 citations, double the amount from the sexual abuse scandal, which led to Laguna Honda's decertification in April of 2022. The first monitoring survey, Laguna Honda received a whopping 56 patient care-related citations, plus 20 physical plant for a total of 76, which Mr. Pickens and Dr. Colfax are now alleging to be 124. In total, Laguna Honda racked up 118 patient care citations in those intervening 3 years and 4 months, plus the 20 physical plant citations, for a total of 138 across the 12 formal state surveys. Add in the 123 mock survey deficiencies in June of 2022, that total 261 deficiencies, plus the 23 or so new ones that you guys have been made aware of, even though you're now in an extended second 90-day survey. As I noted in my article, the sheer volume of deficiencies is a symptom of the gross mismanagement of Laguna Honda and represents something like a pre-mortem. This is what happens when you put managers who have no training or experience in running a skilled nursing facility in charge. Commissioner Green wrongly assumes SFGH acute care clinicians can safely manage a long-term SNP. Thank you for your time.
That is the only hand, Commissioners.
Okay, thank you. Any additional comments or questions from the committee? None? Okay. None on this.
You ready to move on? Okay.
We're ready to move on. Thank you.
All right. So item 9 is an action item. It's Laguna Honda Hospital policies.
Hello, I'm back. My name is Elizabeth Schindler again. I'm covering for Carmen Trin, and I'll be talking about the JCC policies and procedures. There are 10 total policies, hospital-wide, revisions, there are 2 policies. 2510, use the psychotropic medication. Removed consent statement, replace nursing protocol with psychotropic medication for emergency to standard work on emergent medication and updated references. 3101, wireless temperature monitoring system. Added medication room refrigerators to policy and updated appendix. Departmental, facility, 1 revision. LS2, portable fire extinguisher inspection and maintenance. Updated inspection to monthly, but no more than 31 days. Nursing, revisions, 4 policies. D1 2.0, residents, activities of daily living. Updated policy to include razor and electric shaver as contraband. E 2.0, assisting residents during mealtime, added at eye level while feeding residents. E 5.0, enteral tube feeding management, updated enteral policy in response to 90-day survey and updated protocol items and frequency per evidence-based practice. J 1.0, medication administration. Remove narcotic administration will have 2 licensed nurse check and documented in EHR. Revise self-administration section with updated regulations and update herbal supplement act section. Deletion, 3 policies. C 3.0, obtaining nursing forms, medical record appendix 1. Obtaining nursing documentation forms, medical records, and chart orders. Request to delete appendix 1. E 6.0, total parental nutrition. Request to delete and remove to hospital-wide policy. D5 3.0, cast care. Request to delete and use Elsevier.
Okay, thank you. Do we have public comment?
Yes, we do. Folks, we are on item 8. If you'd like to make a comment, please press star 3. I see one hand on mute. Caller, I've been muted. You please let us know that you're there.
I'm sorry you guys are having to put up with me again, Mr. Morowitz. It's Patrick.
Oh, please speak up.
It's disappointing seeing today that the restorative nursing care policy is still not being presented to the JCC for approval. As a reminder, the nursing department and the rehab services department quibbled for a long time about who was going to take ownership of the program. The first RCA report, root cause number 8, was cited as, quote, lack of a formalized restorative nursing program, end quote. It claimed as part of the milestones that gap analysis study would be produced by January 25th and a scope of services document completed by February 8th. I obtained both documents. Comically, they were essentially 2 different versions of the same document pretending to be different. They were mostly a rehash of a pathetic PowerPoint presentation Laguna Honda created in 2018, which Laguna Honda refused to name the document's author. The documents contained nothing like a typical gap analysis study or a scope of services report, as if written by someone without analytical skills. It had terrible formatting, again, from the nursing department. When will this JCC calendar, the restorative nursing care policy for adoption? I do want to thank Ms. Harris and Ms. Baristo for just emailing me the partial 2567 report along with a few other documents today. Thank you for believing in the public's right to know what our government is doing. It's reminiscent of the Republicans in Nashville setting out to punish, silence, and humiliate the Tennessee three legislators. The goal should not be to silence public comment, and withholding public documents for unreasonable amounts of time is reprehensible. But Ms. Harris, Ms. Risto, thank you for stepping up to the plate and being a good public servant. Thank you.
That's the only public comment.
Okay, thank you for your comments. Any from the committee, from the commission?
I just had one question about the policy, and that's the enteral tube feeding management, because it looks like, I don't know how much of this represents practical change on the ground versus just change in verbiage, but I know that that area can be very complicated depending on the type of feeding, and I know that one of the residents who passed away at a completely different facility many days after transfer had 2 admissions, and it was really a blocked, I think, gastrostomy tube that was really what triggered the decline. So I'm wondering, whether this really does represent big changes that our staff will have to learn, and also whether, in the same way we have we recognize the importance of wound care specialists, whether if this is a big transition, whether there's individuals who have specific skill in enteral tube management that might be brought on board to ensure this is a smooth transition.
Yes, thank you for that question. I'll try to answer it without asking Elizabeth to opine. So it does represent a major change, both because of some of the findings from the last survey, where that resulted in wound care and nutrition being one of those 4 unit-based QAPI programs that's being rolled out. So we brought over the enteral specialists and the wound care specialists from Zuckerberg over to Laguna to assist the team in making improvements to both the policy and the practice. I know for example, one of the new improvements is really defining the position degree of placement in the bed. I believe it's 35 degree angle that is now spelled out as a requirement for enteral feeding in order to make sure that the nutrition is progressing appropriately through the tube and into the body. So the new policy does reflect many of the learnings and the surveys over the last year, and that yes, those external resources have been brought in and continue to be part of the Laguna effort to improve both wound and nutrition care and specifically enteral feeding.
And then do we expect to have subject matter experts on the ground in both those areas as time goes on?
We do. I don't know the specific plans, but I'll follow up on that with Terry D'Antoni, our nursing director.
Great, thank you.
Okay.
Okay, no additional questions.
So do we have to approve this?
So this is an action, I'll just repeat it, action item to recommend to the full commission approval of these policies.
Okay, may I have a motion?
I recommend we approve these policies to the whole commission.
Okay, second.
And then you all just have to do a vote.
Oh, okay. So even though there's only 2 of us?
Yes, because in-person meetings, you have to do the old-fashioned, all those in favor.
Okay, all those in favor, say aye. Aye.
Okay, great. Thank you. I will put this on the consent calendar for the next Health Commission meeting on the 18th. We're at item 10, a consideration for closed session. If there could be motions, then we'll go to public comment.
Move to go into closed session.
Okay, second.
Great. And folks on the line, if you'd like to make public comment, please press *3. I see one hand. Oh, and Commissioner, would you like to make your statement?
Yeah, so, I'd like to make a statement before public comment. The JCC governing body bylaws require us to go into closed session to discuss quality improvement and peer review matters protected by Section 1157 of the California Evidence Code in order to avoid waiving those protections.
Thank you. And I will go to the one public comment. Mr. Minetshaw, you're unmuted. Please let us know that you're there.
All right, thank you. And before I start, let me just say I wish you all have a relaxing evening. Here I go. As you enter closed session, remember an adage, quote, silencing dissent and public participation comments in democratic government is a sign of weakness, not a sign of strength, unquote. During closed session, I hope you will consider Dr. Palmer's remarks about the potentially considering revising your three-tiered structure for taking public comment. You talk a good game around quote-unquote equity, but three-tiered public comment periods are anything but equitable. Folks having a disability may not want to be pigeonholed and outed as being disabled if they are coerced into self-identifying as such in order to qualify for reasonable accommodation. That's the opposite of quote-unquote equitable, and it's discriminatory. This body should have gotten the message about silencing dissent and restricting public comments to a 20-minute period for people who choose not to have the artificial label of quote-unquote disabled thrust upon them. As I mentioned, Republicans in Nashville set out to punish, silence, and humiliate the Tennessee 3 legislators. If your goal is to silence public comment, you're no better than those Republicans. In closed session, you should debate going back to a two-tiered comments policy. First, for speakers who appear in person, and then one single call-in period without requiring accommodation codes. I just skim-read the scroll to the 2567 that Ms. Roristo and Ms. Harris sent me, and it's good saying that in the partial survey, you did not receive any immediate jeopardy or actual harm citations that were not an immediate jeopardy. And yet you did receive, again, widespread deficiencies that do not provide actual harm.
Your time is up, Mr. Minetshaw. Thank you. And just to clarify, Commissioners, the topic that which Mr. Minetshaw mentioned cannot be discussed in closed session because it's not a quality matter around public comment. All right, so if you two could take a vote on, you've made motions to take a vote on closed session, we could go into
All
it.
those in favor?
Aye.
Right, so please give me 30 seconds. Folks on the line, you will not see or hear us, but we'll be back after the closed session. Everyone else, give me 30 seconds to switch us over. Back into open session. Commissioners, please consider a motion to disclose or not disclose discussions held in closed session.
Move not to disclose.
Second. All those in favor?
Aye.
And then finally, a consideration for adjournment.
Move to adjourn.
Second. All those in favor?
Aye.
Thank you very much.
Okay. Thank you.